I'm Desiree Miles, semester one, spring 2026, and I'm doing Foley care. Now my package is some still sterile. I'm gonna pretend it ain't been opened yet. All right, so starting from the beginning. Knock. May I come in? My name is Daisy. I'll be a nurse today, and today we are going to do anchor of Foley. Can you tell me your name of date of birth? I'm gonna compare it to the bracelet they have on. Do you have any allergies? Any contraindications to doing Foley? I'm gonna check the order, make sure I have the order in place. I'm gonna wash my hands. I'm gonna put on clean gloves. I'm gonna open the kit. I'm gonna start over so I can make sure I have enough space. Just like here. This is my patient. This right here. Hands are clean, got clean gloves on. I assess the patient, vitals, everything's fine. No contraindications to doing this Foley today. So today we're going to do a Foley, so we insert the catheter to help your urinary flow. All right. So then I'm going to take off the sterile gloves. Well, before I take off my sterile gloves, with my clean gloves, I'm going to have provide peri care, incontinence care, everything. Make sure my patient is prepped for the Foley. So then I'm gonna take my clean gloves off and wash my hands. And then I'm gonna get my sterile gloves, not contaminate anything else in the kit. Make sure everything stays sterile. Everything's at waist length. Always keep my eyes on the sterile field. Only gonna touch the very bottom inside of the glove. These are kind of tiny. Okay. And then I'm gonna pick up my other glove. So now I got my sterile gloves on. I'm going to prepare all my other things to begin this Foley care or insert the Foley. I'm going to place for the ladies. I usually just put it underneath just in case the betadine gets on the sheets or the clothing, whatever they got going on. All right, I'm gonna set my betadine sticks. Usually I just tear it open and just have it sitting there. My petroleum, I will open it and go ahead and squirt it in my kit and then have this ready. And then I'm going to grab my Foley catheter kit or my Foley. So I have my petroleum already there. I would take this off, get the air out, hook it onto this port. This will fill up the balloon once I have it anchored inside the resident or patient. So I guess I'll just go ahead and do it. That's in place. For this part, I want to keep sterile. And so I'll go ahead and take off the cover. I wouldn't let it dangle like that. I'll control it. I'll put it in the petroleum and I'll leave it right on my sterile field. Now I'm gonna choose which hand I want. It's my dirty hand, which hand is my clean hand. And I'm right hand dominant, so I'm gonna let my left hand be my dirty hand. So with my dirty, so my lay down's open, my dirty hand, I'm gonna hold back the labia, so we can expose the meatus. Is that the right word? In the urethra. All right. So then I pull up my beta down swab. This is kind of awkward without a person. And I'm gonna wipe down one side, toss it, grab another one, wipe down the other side, toss it, wipe down the middle until I think my patient's clean or can visually see that it's clean. Next, make sure my catheter is lubed up thoroughly. Keep my dirty hand here. This is my clean hand. I'm going to control it so we don't get this contaminated. And I'm going to insert it into the urethra. Well, my tape came undone. About 2 inches or until a little resistance. This is my dirty hand, so I'm going to hold it in place. All right, and then I got some flashback. I got some urine flashback. So we're in the right spot and it's doing what it needs to do. So while it's here, I'm going to hold it in place and I'm going to blow up my bulb. The bulb is blown up. I'm going to give it a little tug, make sure it's secured. And then I'm going to take my sterile gloves off, wash my hands. And then I'm going to come put some new gloves on. I'm going to put a stat lock on. I'm going to make sure I have the time and date and my initials on here. I'm going to make sure my Foley bag is hanging below the bladder so we can drain and not go back into the kidneys. That time and date. If I need the urine sample, we'll do the first clean catch. Make sure I got everything. I'm gonna ask my patient how they feel, any pain, assess them, how it's going, make sure it's draining. I'm gonna document how much has came out. I'm gonna document if there's any trauma related to the procedure, patient's response. I'm gonna ask the patient if they need anything. Can I get them anything? Make sure they have a call light. Make sure all safety measures in place. And can't remember if I said I'll verify the doctor's orders first, and then provide medication stuff as the medication administration rights, follow all the rights. So my Foley's in place, my patient's urine is draining within normal limits. I'm gonna document the color of the urine, the smell, how does it look, all the things. If there's any abnormal, make sure I call the nurse practitioner or the doctor and notify them to get any new orders. Make sure the resident's comfortable, and that would conclude. I'll document, wash my hands before I leave, and that concludes my Foley care.